Good morning, Sue Ring here with the Kissimmee Osceola County Chamber of Commerce, and welcome to our weekly webcast series where we explore a timely topic, community initiative, or civic program. Here at the Chamber, we are champions for business and community. That includes providing our followers and members with the information they need to stay safe and healthy. We all know that the holiday season brings added stress and pressures that can lead us astray when faced making healthy food and behavior choices. We are thrilled that our sponsor and health partner at Orlando Health is making available to us a special guest this morning that can guide us on how we can manage stress and nutrition this holiday season. Dr. Chad Campbell will provide us with the tips and techniques we can all use to keep us sane and healthy during the holidays. And of course, we are live. So if you have any questions or comments that you need to address, feel free to pop them up and we'll be sure to address them. Just so you know, Dr. Campbell is an internal medicine physician with Orlando Health, Physician Associates in Internal Medicine. With a personalized approach, he cares for patients from infancy through their senior years and provides wellness checks, physical exams, immunizations, treatment of common illnesses, and management of chronic disease. Dr. Campbell completed his education and postgraduate training from the fine state in Arizona. He earned his medical degree from the Midwestern School of Medicine in Glendale, Arizona, and his undergrad from Arizona State University in Tempe. So good morning, Dr. Campbell. We're so glad that you could join us this morning and help us, manage through the holidays. Can you explain to us how nutrition impacts our stress management?
Yeah, well, first of all, thank you for having me. I'm very honored, and thank you for changing the date for me. I do appreciate that. It meant a lot. Nutrition and stress are tied very closely. Unfortunately, a big part of our stress is handled by our body secreting sugars, or cortisol, which secretes sugars. And those sugars obviously get turned into storage or fat when we don't use it like we need to. So it's important during the holidays and during any time, but obviously the holidays, to make sure that we are eating meeting our body's nutritionist needs and not exceeding the needs of our sugars, or else it's just more storage, which we all see those 15 pounds or 10 pounds during the holidays.
That's why the gyms are always happy when the new year, when the New Year's rolls around, because all of those holiday choices that we made are not necessarily that. They always say, like in college, when you gain the college freshman 20, well, it's right. It's the holiday 15 that we all face at the first of the year.
Yes.
How does the holiday season impact our stress management? Obviously, we're faced with trying to make all these good choices. How do those kind of play into each other?
Well, again, the problem is during the holidays, we put extra stress on ourselves. And the number one way Americans deal with stress is eating. So that's one issue we have to keep conscious in the front of our brain, is when I'm stressed, I'm hungry, and it's not necessarily because my body needs that. It's just because that's what I've trained myself to do when I'm hungry. Unfortunately, also, a lot of the holidays is about, not unfortunately, fortunately, a lot of the holidays is about getting together and just spending time with each other. And so we're not keeping ourselves busy in those times when we're being social. And when we're social, Americans, again, tend to just eat and drink when we're being social. So we're kind of set up for the holidays for extra nutrition and extra stress.
And what is the impact of stress and proper nutrition? Why is it so important to our overall health?
Well, stress and nutrition, if not taken care of, gets put into our body in different ways. So bad nutrition, well, let's start with stress. bad stress, as we talked about in the beginning, releases sugars, cortisol, which goes into storage and causes fat. Bad nutrition increases our cholesterol, increases our sugar. And these things eventually take a toll on our body, leading to diabetes, heart disease, and dramatically increasing our risk for stroke. But it's important to tie together stress and nutrition together. I agree with you 100% because they usually go hand in hand. But we do have those individuals who are very good at eating correctly and eating the right thing, but their stress level is through the roof as well. And it's important for those individuals to know that they can do just as much, if not sometimes more, harm on their body by the level of stress, even if they're eating correctly. Just by not dealing with their stress during this time, they can increase their blood pressure, increase the risk for stroke, increase the risk for depression. So again, both of them take a big toll on our body.
So what are some techniques or some tricks that people can do, not only in trying to manage and making healthy food choices, but also in their stress management?
So one of the things I like to tell patients is if you fall off the wagon, then hop back on it right away. I think this is the most helpful tip I learned in some of my training when I go to conferences. And it's especially true for the holidays when we like to make deals with ourselves. So we say, I'm going to let myself go, and then I will start doing good on January 1st. But that's the danger, because we are very good at moving that deadline and moving things a little further away. I'll start January 11th. I'll start January 17th. So what they teach you is if you're sitting there with your third cup of wine and a big plate of caramel popcorn and 7 cookies, and you realize it, then at that moment, make the choice. Say, this is not a healthy choice for me right now. I'm going to put this down and start with something else. They also show that, and it's interesting to teach your mind this. Again, a lot of stress, a lot of good nutrition is just retraining our mind. But if I give you the same number of calories in bad food and the same number of calories in good food, that you, at the end of eating them, you'll feel healthier and you'll have less stress eating the same number of calories in good food. So that's a trick to keep on telling yourself in your mind when you're hopping back on that wagon of eating healthy, that you need to make sure to eat the same number of calories in good food, and you'll feel better and have more energy for the day and less stress because you have that more energy. An easy trick when you're at the parties, just one other thing I wanted to put in there is to
right ahead.
Is to make sure that to carry a big glass of water around, or your thermos of water. If you keep your belly with something in it, with some water, then you're less likely to pick up things and snack on them. So,
are there any dietary recommendations that you could make in helping in, relieving or minimizing stress?
Dietary restrictions in general is, again, in the holidays, if you can increase your protein, then you're less likely to stress your body to have those oxidants floating around that can make you feel stressful and make your body feel stressed. Hydration is a key during this time. Make sure that you're not consuming a lot of alcohol, consuming a lot of caffeine. Your body feels that stress 100% when you are dehydrated or under the influence, or again, have all that caffeine in your system. And then, although we do end up excreting a lot of multivitamins we take, just taking a multivitamin during the every day, but especially during the holidays, is a good idea for the dietary purposes of relieving that stress.
I have heard or read about that there's some concerns about like the up and down or the yo-yoing effect of, if we talk about the cheat days, it's like, I'm going to, go all in for the week of the holidays, and then I'm going to crash and do really well at the beginning of January, and everybody's great at the beginning of the year, and then that 6-week high of being really motivated kind of falls by the wayside, and you go and in the up and down effect. Does that cause like some long-term damage or concerns to someone's overall health?
So you are correct. A long time ago, they brought up concerns of the yo-yo dieting or yo-yo weight effect of being up and down, and it is true that takes a toll on your body. However, we now know, probably in the last 3 years, that there is benefit regardless of how long you are down on the dip of the yo-yo, that your body does appreciate that time when you are healthy. So yes, you are 100% right. Yo-yoing is not ideal, but if that's what your body is doing, then you should appreciate those down times in the yo-yo and focus on making those times in the downtime or your lower weight or your healthier time, make those periods longer and longer than those times your weight is up and those times you're unhealthy. Kind of something I did want to touch on as we were talking about this and other things is part of it doesn't just go nutrition to stress, it goes stress to nutrition, as we did mention. So when you're stressed, we tend to eat more, and something for people to remember, things that I tell people is to we have this ideal image of ourselves, ideal nutrition, ideal weight that we want to get to, and it's important that we don't put too much stress on us as individuals, especially in a year like this, where probably all of us already are a little heavier than we want to be because of this year. So it's important for people to be realistic and make smart choices, but if we make a wrong choice, to not let it beat us up and cause more stress, or else it's just this vicious cycle of stress, bad eating, stress, bad eating. So I made a mistake. I'm done. That's fine. I'm hopping on the wagon, or I'm 5 pounds heavier than I want to be. That's okay. I'm going to get there. I'm not going to stress out about this. I'm going to start doing things correct right now.
And exercise, I imagine, can play into this, because there's studies that exercise can be a stress reduction, or how does that play into in managing your stress?
Sue, you are a genius. Yes, 100%. There is no doubt. There are some things in medicine that are debatable, or it's not obvious, but stress reduction with exercise is not debatable. Exercise is one of the main ways that we recommend people reduce stress. But again, just so you don't beat yourself up, exercise is not meant to be that 10 out of 10 exercise, that person you see at the gym on the treadmill running like crazy for an hour long. They say it's more about the consistency of the exercise. So if you can exercise every day for 15 to 20 minutes at an intensity scale of 3 out of 10, which is a brisk walk, but fast enough or slow enough that you can still have a conversation with someone next to you. If you can do that every day for 20 minutes, that's healthier than you exercising 3 times a week at an intensity of 10 out of 10 for 30 minutes. So it's just about consistency. It's just about getting out and doing that walk. And we all know it when we do it. We come back and we thank ourselves and praise ourselves for doing that, because we feel great. But we're so good at making excuses. And it's just about that consistency, not beating ourselves up and causing more stress because we're not exercising, just saying, today I'm going to go for a nice walk for 20 minutes. So.
Well, and it's funny because we also, you think of the mindset where you have these images in mind of the perfect person, the perfect weight, and the number of hours that you have to spend at the gym. And it's the simple things that we can all do and the choices that we make that can lead to a healthier human as we going forward. So in closing, is there any special concerns that, obviously with COVID, that things that we need to do this holiday season just to make sure some extra precautions that we stay safe in managing that stress level?
Yeah, that's a great question, Sue. Oh, I wish I could give you the exact answer. The scientific answer and I guess the physician answer is to be smart, wear your masks when you're in public, when you're with people that you aren't in your normal family circles, and try your best to stay 6 feet away and to wear the mask. So that's the scientific answer. But the personal physician side of me, because we were talking about stress, it's been an incredible hard year for everyone. And the stress just makes us want to not exercise, makes us want to eat unhealthier, increases our depression and our frustration. So the personal side of me is don't be afraid to be with your loved ones in a smart way, whether that's through Zoom calls or calling all of them, or all of you meeting out at a park with masks. We need to be around our loved ones and enjoy each other and reach out to people and refill our cup, as our therapists would say. So this is an important time of year to do that, and not try to increase our stress, kind of use this season as a time of refilling our cup.
Yeah. Well, those are wonderful words as we, the holidays are at the end of this week, that as we close, and Dr. Campbell, we can't thank you enough for taking the time this morning to share your insight with us. And we wish you and everyone, your patients and everyone, a very happy and healthy holiday season. So thank you, everybody. Have a wonderful day.
Thank you, Sue. Bye.
Bye-bye.